Having now briefly summarized the steps of the review process for findings from single case designs, we will next describe the first few steps in more detail. Because the outcome measures requirement was described in detail in the previous module, we will begin now with the data availability step. When reviewing findings from single case designs, reviewers must check that raw data from the study were made available in either graphical or tabular format. Here you can see an example of how such a graph or table might appear in an original single case design study. If a finding does not include the raw data in graphical or tabular format, it will receive a research rating of does not meet WWC standards. If tabular data are not available in the original study report, but the study findings would otherwise meet WWC single case design standards, reviewers will draft an author query to request the raw data file. In the case that the authors do not provide tabular data, the findings rating will not change, but the WWC prefers to use author-provided tabular data for estimating effect sizes and other calculations. It is important to note here that single case design researchers almost always present raw data in graphical format, meaning that most single case design studies will easily satisfy this requirement. The next step in reviewing findings from single case designs is determining if the independent variable was systematically manipulated, with the researcher choosing when and how the independent variable changes. The key consideration here is whether the researcher was in control of when the intervention took place. To meet this requirement, the researcher could still consult with other individuals on the timing of the intervention, including teachers or school administrators. However, the researcher should be the one ultimately in control of the systematic manipulation of the independent variable. Otherwise, if teachers or administrators are the ones who choose when to introduce or withdraw the intervention, then this would not be considered a systematic manipulation by the researcher. WWC reviewers should provide study authors with the benefit of the doubt when applying the standard if the study report does not provide explicit language about the systematic manipulation. If there is no compelling evidence to suggest that the researchers were not in control of when the intervention took place, WWC reviewers can assume this requirement was met. Nonetheless, if there is some ambiguity regarding this requirement, then WWC reviewers should check with topic area leadership to determine whether any assumptions made by the reviewer are reasonable or whether an author query may be needed to request more detail from the primary study author. The next step in the WWC's process for reviewing findings from single case designs is to determine whether, when applicable, the study was free of residual treatment effects. Residual treatment effects occur when the effects of an intervention in one phase are carried over into subsequent intervention phases in the design. So, residual treatment effects are typically of most concern in alternating treatment designs, where there's a rapid alternation between multiple intervention conditions. Residual treatment effects might be present in other single-case designs. However, such as treatment reversal withdrawal designs, when an intervening third condition is present. Although timing of phases in these designs typically means that residual treatment effects are not a concern. According to the WWC single-case design standards, if both the content expert and WWC reviewer both agree that residual treatment effects are likely in a single case design, then the study findings are rated does not meet WWC standards because the measures of effectiveness cannot be attributed solely to the intervention of interest. It is important to note when evaluating whether residual treatment effects are likely in a design, these decisions should not be focused on the patterns of data within an individual single-case design study. Rather, the WWC content expert and reviewer are expected to make this determination solely based on domain knowledge expertise or previous evidence regarding the outcomes and interventions of interest, combined along with knowledge of the timing of phases and observations. Given this reliance on content expertise rather than empirical data from the study at hand, content experts must be involved in this process. Thus, WWC reviewers who have any concerns about residual treatment effects should document those concerns in the study review guide and flag these concerns for further review by topic area leadership, including the review team content expert. Time for your first knowledge check in this module. Researchers are observing students in several special education classrooms in a single school district, repeatedly measuring the percentage of off-task behavior in 20-minute windows throughout the week. The school district decides to implement a new special education curriculum to improve student attention to academic tasks, staggering implementation timing due to limited training resources. After the school district implements the curriculum, the researcher decides to use a multiple baseline design to continue observing the students' off-task behavior to document the effects of the curriculum as it is introduced in the classrooms across the district. Would this study meet the requirements for systematic manipulation of the independent variable? Your choices are A, yes, or B, no. You may want to pause the video now to think about your answer. The correct answer is B. In this scenario, although the independent variable may have been systematically manipulated, the researchers did not determine when and how the independent variable conditions changed. Rather, the school district made the determination of when and how the independent variable conditions changed. This study would not meet the requirements for the systematic manipulation of the independent variable, and the highest possible research rating this study finding could receive is does not meet WWC standards.